Do sex addicts ever actually stop their addiction? That's a great question. I'm Dr. Trish Leigh. I'm going to answer it for you. The answer is no, not really, but it has a caveat. The caveat is that that addiction can be controlled to the point where it's almost non-existent for the rest of that person's life, with the right help, of course. So it plays out like this in a few steps, if you follow me. So if someone is struggling from a sex addiction, what that means is they're acting out sexually. That can be watching pornography, using prostitutes, having affairs, voyeurism, exhibitionism, fetishes, lots of different things. All of those acts are serving to dump some dopamine and dump some natural opioids into that person's brain to soothe their pain and help them feel some pleasure because they have pain inside. So the proper coach or counselor will help them to stop whatever behaviors that they are doing, to numb the pain and to not feel those emotions that are buried in there. But then that coach or counselor has to help the person to go to work on the pain that is inside. When you're able to do that and release that pain, then there's really no need to go back to the behaviors to soothe the pain because the pain has been resolved. And we know that sex addiction starts in the brain. It's a brain pattern that's caused by this trauma pattern and then this need for stimulation and this need for anxiety relief. So when we change the brain and if the brain stays in the optimal mode, that's how we know that that person's not likely to go back to the addictive behavior. But the caveat is they need a strong support system in place. That's what recovery is about. Recovery happens in the moment when a person is coming out of that addiction, but honestly, there needs to be some level of support there for the rest of that person's life. Usually that's in the form of a sponsor or a mentor or a coach that can be trusted to help that person work through anything that might come up in life. And it's not a matter of regression. It's a matter of there may be new pain in the future that might bring up some of these old need to stuff that pain again. And if the person can work through the new pain, then that addictive behavior doesn't happen again. Okay, I hope that helps you understand. And remember, control your brain or it'll control you.